And speaking of healthcare,
I'm providing very good segues for you from question to question.
you're very cooperative. Healthcare is a major concern across America as tens of thousands return from the war. The economy's plummeting, job losses are skyrocketing, and the costs of good medical care are becoming increasingly unaffordable for millions of Americans. So what can you do in the Senate to ensure that families on all socioeconomic levels can receive proper medical care when needed?
Yeah. You know, we're spending 18% of our gross domestic product, 18% of our economy is in health care. And yet we have 50 million Americans without access to health care. And it isn't that we don't provide health care, it's that it comes in the most expensive and least effective form, which is in the emergency room. That is a terrible situation to be in. The costs of the emergency room get transferred onto those who still have insurance. The cost of insurance goes up, and then small employers can't continue to provide insurance, and then we have more uninsured. And that's what's happened over the last 8 years. We have far more Americans today without health care than we had 8 years ago. So we've got to break that cycle. And that's why I support Ron Wyden's Healthy Americans Act, to fill in between the health care programs we have to enable every American to have affordable, accessible health care. But we need to also do other things. We need to invest in prevention. We need to invest in disease management. We need to proceed to break the monopoly on Medicare Part D, which is the drug program for Medicare that has monopoly pricing. You have to accept the price of whatever the drug companies are charging, which means that we are held hostage, and our seniors and our Medicare pays a higher price for drugs than any citizens anywhere on the planet, even though often it was our tax dollars that did the research that created these marvelous drugs. So we have to break that monopoly and invest in prevention and invest in disease management. It's important, in other words, to use our healthcare dollars in a far more effective fashion.